So today we are going to be demonstrating a treatment of stretch marks. As mentioned in the presentation before, treating stretch marks is one of the challenging skin conditions, and in many cases we are not able to return the skin to a normal status 100%. In many cases the maximum improvement of the stretch mark is going to be 40 to 60%, and this requires combination of treatment. As you can see, this is not a severe case of stretch marks, it's mild to moderate, and we gave the patient an option of using the non-ablative Nd:YAG alone with the FRAC3, which requires maybe 5 to 7 sessions with 3 weeks interval in order to get to the 40 to 60% improvement. However, there is another option where we can combine the non-ablative rejuvenation with the FRAC3 with the Nd:YAG with the ablative fractional Erbium-YAG laser, where we can do it in the same session, starting with the Nd:YAG, ending with the fractional Erbium-YAG with a handpiece called FS01, which is a fractional handpiece. And in this case, with this combination, we are able to stimulate the collagen in a much better way, but the patient has to know that there is a downtime, some micro crust which will form, and this is going to stay for 5 to 7 days. And the patient today prefer to have this combination treatment in order to have faster improvement of the skin, and this is what we are going to be demonstrating today. So now we are going to start with the Nd:YAG. So we go to the Nd:YAG, and then again we can go to the expert mode, and we are going to be using the same parameters which we are using for non-ablative rejuvenation, because the objective here is to stimulate the collagen. So I'm going to be using the R33 with 9 millimeter spot, 0.6 millisecond, 15 joule per centimeter square, and 5 hertz repetition rate. So this is the parameters which I'm going to be using for today for the first step using the Nd:YAG. After that, we are going to switch to the Erbium-YAG and use other settings which will show at that time. So the patient is wearing the laser safety goggles, as long as we are working on the body, not in the head and neck. So she can wear the goggles which are she can see through, and also the operator has to be wearing the goggles. After everything is okay, everyone attending the room is wearing the laser safety goggle, then we put the machine on ready. We confirm that we are using the right spot size, wearing the goggles, and now we are ready to go. We are going to work on the area which is having the stretch marks. So again, this is 5 hertz, so we have to be moving all the time. So it has to be in brushing or painting mode, and we have to be moving all the time so that we are avoiding the too much heating of certain spot. We did not apply anesthesia, and we are not using cooling. Again, the objective is to increase the temperature to about 42 degrees and maintain that for 3 minutes. And this is going to induce a mild inflammatory reaction in the skin. With acute inflammation, we are going to have cells called fibroblasts, and the function of fibroblasts is to synthesize new collagen. New collagen is going to be deposited in the skin in this area within 3 weeks, but this is immature collagen, collagen type 3, and this needs to mature to collagen type 1, a process which takes 6 to 8 months. So it's a gradual, slow process, but it is very effective and it works well. In order to fasten the reaction and the improvement, we are going to combine this treatment with the ablative fractional Erbium-YAG treatment, which is going to be following this step of the Nd:YAG. We can see that the erythema started to happen, and we will ask the patient about the pain. Sarah, let us know, how do you feel?
Okay.
Okay. Is it too painful? No.
Very hot.
Okay, so it's gradually increasing the temperature, but still it's very tolerable, and I think the score of the pain is going to be not very high. If you want to score that pain from 0, which is no pain at all, to 10, which is the most severe pain, what grade would you say? 2. So the pain score is around 2, which is very tolerable, and having a procedure without anesthesia and without cooling, I think this is very much acceptable. It is even less than the laser assist hair removal. I'm not sure if the camera can show the redness, the erythema, which is very obvious now. I will measure the temperature in a minute to make sure that we are at the right temperature, and then we would like to maintain it at a temperature of 42 for about 3 minutes. So this is about 44. It's a little bit higher than required, but still it's okay. So you'd like to maintain now. With a newer option, which is going to be available soon in Canada, there is a Matrix View option with the handpiece, which is going to be a temperature sensor where we can adjust the temperature we would like to achieve on the screen. And in this case, there is a light guide which is going to give you certain color codes according to the desired temperature. So if it is green, then you didn't reach the required temperature. When it's yellow, then you are at the level you would like to be. When it's red, then it is exceeding the temperature you want. So you would like always to be at the yellow color, and this is very nice and very easy to use option, which is going to be available soon in Canada. But till it is available, we are using the infrared thermometer, which I used in order to monitor the temperature and keep the temperature at the level we would like to keep. So we can see the redness now. It is very clear. The temperature is 43, and this is what I would like to maintain. Stretching the skin a little bit is going to help the optical penetration of the laser and will improve the outcome. How is it feeling, Sarah?
It's hot.
Okay, it's a little bit hot now, so we can work on a wider area. And another thing we can do is to decrease the fluence. We can decrease the fluence as long as we achieve the required temperature. In order to make the treatment more comfortable, I would decrease it to 10 joule instead of 15, and then continue with the treatment just to maintain the temperature at that level for the next 2 minutes. So this is going to be more comfortable now because we are just maintaining the temperature at that level and not heating it more than that. Using the 9mm spot is going to ensure that the depth of penetration is going to be significant and enough, and this is going to improve the outcome. If we use the 6mm spot, then it's going to be more superficial, and we need the deeper penetration in order to get some tightening in addition to the collagen stimulation. Is this better now? Excellent. So now when we decrease the fluence to 10 joule instead of 15, it became more comfortable. And I'm going to show you the temperature now, which is still maintained and in the right range. So the temperature now is 43, and it is the right level we would like to maintain. We are scanning the laser pulses over the area. We are not targeting only the stretch marks because we would like the collagen stimulation to happen on the whole treatment area. And this is going to help the stretch mark to improve, and also the surrounding area is going to have better collagen content. So this is going to be helping the stretch marks to improve. If the patient is having a degree of skin laxity, I would have started with the piano mode, where this is a much longer pulse duration in the seconds, and this is going to be associated with deep heating and tightening of the skin. So in cases where we have a degree of skin laxity, we would start with piano in order to tighten the tissue, the skin, followed by the frag 3, which is this step in order to stimulate the collagen, and ending up with the Erbe-Mieg. But in this case, where we don't have too much skin laxity, there is no point of doing the first step, which is the piano, to tighten the skin, as there will be no significant change or improvement. If I'm going to be using the piano, I would be using the 20 millimeter spot with R34 handpiece, and then I'll be using 120 to 150 joules per centimeter square according to the how large the area I'm going to treat, with 5 seconds pulse duration. Of course, having the option of pulse duration in the seconds, this is limited to this laser from Photona, where there is no other NDX system which can provide such long pulse duration. When we are using this long pulse duration, then the effect is going to be deep tissue heating and tightening. But if we increase the temperature a little bit more for longer time, we can also get lipolysis, and this is the tight sculpting, which is going to be a subject of another webinar. So we are almost done. We can see the erythema and the redness, and we can see that the temperature is quite high. It's 44 degrees now, which is still tolerable, as we can see, and we treated the area for 3 minutes. We maintained it. And now it's going to be the next step, which is using the Erbe-Miag, fractional Erbe-Miag, in order to target the stretch marks and stimulate more collagen synthesis and improve the outcome of the procedure. Okay. So now, after finishing the first step and the Nd:Egg, now we shift the machine to the Erbe-Miag. So we press the Erbe-Miag button, and then we go to the fractional skin resurfacing, where we are going to be selecting the handpiece, which is the FS01. This is what I'm going to be using. And with that, we are using the MicroShort Pulse with 4 joule per centimeter square, and this is going to give us 11 microns of ablation and 12 microns of coagulation. So this is a very good balance between ablation and coagulation, and I think this is going to be ideal for treating stretch marks with very acceptable pain tolerance and very good clinical outcome. So this is what we are going to do. This is 4 Hertz, so we have to be just scanning the pulses over the surface of the skin, as we are going to be seeing. So everything is set. We have the handpiece, and the machine is going to be put on ready, and we'll start. So we start now scanning the laser pulses over the stretch marks. This is 4 Hertz, so 4 pulses per second, and we have to be moving the handpiece continuously. How is the pain, Sarah?
Good.
Good. As we can see, it is very quick treatment, associated with almost no pain, but significant gain. So we treated the whole area now, and I would like to, if possible, the camera to zoom in order to show us how the skin is looking immediately after, and the microthermal zones which are on the skin after the procedure. So we can see that the skin is having those microthermal zones, quite a little bit of erythema, but nothing more than that. Is there any burning sensation, Sarah? just like a tingle, and we are going to be applying a skincare product which is going to be soothing and hydrating the skin. So this is going to alleviate any tingling sensation. It has to be applied on the skin. Good moisturizer, something to promote the re-epithelialization of the skin, and this is something to be applied every 3-4 hours to avoid any crust formation, microcrust formation. And we are going to see Sarah within a week to see how the skin is healing. We expect that within 1 week the skin is going to be almost back to normal, and the next session is going to be done after 3 to 4 weeks, and we expect to need 3 to 4 sessions on monthly intervals. So we can see that all what we can see now after applying the moisturizer is a little bit of erythema, which is going to subside within 1 day or so. Sarah, any questions?
No.
No, so the treatment is done.